Hi, I am Nandu Pillai and welcome back to a new video. In our last conversation with Dr. Lakshmi Nair, we discussed about the lifestyle habits that influence our mind like sleep, focus or stress. But today we are going deep into a habit that is affecting all of us, kids, adults and even families. I am talking about doom scrolling aka phone addiction. That endless cycle where we pick up our phone for just 2 minutes and suddenly half an hour is gone. To help us understand this even better, how it impacts our mind, body and relationship, we have with us here Dr. Lakshmi, MD in Ayurveda and a mental health specialist. Dr. Lakshmi, welcome back. It's always a pleasure to have you here.
Thank you so much.
Let's begin with the obvious. People think that mindless scrolling is absolutely harmless. But is it really harmless? How is doom scrolling really affecting our people like kids, parents, or even families?
So, this doom scrolling is considered as a compulsive pattern which impacts negatively the lives of the people by the obsession and compulsion of excessive screen usage. So, mostly this is actually utilized as a maladaptive behavior or a coping mechanism to reduce the stress, or maybe if there is a sleep related issue, this is used as a maladaptive behavior like scrolling again and again and again. So what happens is that there is a like with this constant addiction, I can say it's an addiction. So with this addiction there is a lack of communication between the people, the family members, the loved one, and also the social connection with the outside world is also impacted in one or the other way.
So you're saying it's not just in our mind, our physical health is also getting affected. Can you explain that a bit?
Yes, actually not only the quality of the sleep but the quantity of the sleep is also impaired in such scenarios. So what happens is that when your sleep pattern is disturbed, it can hamper your gut health, your digestive system, which in turn causes a metabolic disorders or hormonal imbalance. So many related issues can occur in such scenarios. And even stress induced disorders like an anxiety or depression, and this can even increase the tendency of procrastination or maybe reduce the work performance, or even which hampers relationships also.
That's the part people often ignore. They just feel that it is just a time pass or a wasted time, but not the long term harm. They are not causing any long term harm. So what about the hidden damages which shows later in our life?
So this long-term addiction can lead to a chronic activation of this HPA axis, or hypothalamo-pituitary adrenal axis, which hampers the gut health, the digestive health, and even the fertility level. So insomnia is most commonly seen comorbid along with its generalized anxiety disorders or obsessive compulsive disorder sometimes, and this can even hamper, or this can even impact as a shortened attention span or the concentration span, which is usually seen in young adults.
So basically doom scrolling is like rewiring our brain to always chase quick dopamine hits, right?
Yes.
That may be the reason like real life feels boring, like we don't feel like reading for a 10 minutes or working productively for half an hour or even sitting silently for 10 minutes.
So basically these feeds in social media is designed to make a tinge of excitement. So what happens is that these blunt the dopamine receptors, which can make or which can in turn gives a less satisfaction in doing the ordinary activities which they used to love.
Okay.
So this is a condition called anhedonia. So there is a condition termed as anhedonia actually. So where the people tend to reduce the interest in things which they actually love doing once. So that is actually a classical symptom suggestive of schizophrenia itself.
So you may have seen lots of people in your consultation. Have you ever come across some cases where phone addiction was the real cause for their problems?
Especially the adolescents and teenage people who are appearing for the competitive examination or the board examination are often brought by the parents because of their inattention or lack of memory or reduced attention span, concentration problems, which when we probe a lot, we come to know, so after 2020, that everything is digitalized and they have their exam schedule on the tabs or the gadgets itself, and their classes are going on when there is a leave or a vacation. The classes are also going on gadgets itself. So again, there is a tendency to get addicted to the phone because of that, and this in turn makes them, use the screen time a lot, which reduces their memory or their attention span, their concentration. So we have seen a lot of cases regardless of the screen time usage, and this is a common issue nowadays.
So people think that it is actually normal, but it is really an important health issue.
True.
Now the big question. Someone watching this video says like, yes, I am this person, I am addicted to my phone always. What should they do? How do they break this habit without quitting the internet altogether?
Okay, good question. So first thing I would ask is to reduce the screen time, especially during the meals. So we have a tendency to have the food, the dinner, the lunch, the breakfast, everything in front of TV or any other gadgets. So first thing I'll ask them is to reduce the screen time during the meals. The second thing I would ask is to keep a strict timer on the usage or the duration of the applications that they use. And the third thing is, which I also follow, you can switch off the notifications of all the apps, or you can even put the phone on your airplane while you are going to sleep, so that the sleep will not be hampered by any pings.
So it's not about quitting, it's about balance and creating a friction.
Yes.
Can you suggest a 7-day reset plan? Something our audience can actually start today and follow from here onwards.
So wake up with a positive affirmation, do the Surya Namaskara, and start afresh with a glass of warm water every day. Keep the window check limited to 3 to 4 times till the noon time. Have an early dinner, light dinner, preferably before the 7 p.m. and keep the gadgets away at least 2 hours prior to your sleep time. You can also practice foot massage with Tila Taila or Brahmi Taila prior to your sleep. Also consume the golden milk prior to your sleep. Try to be consistent for 7 days to rewire your brain, and which we can call as the brain detox.
So there you have it. It's not a punishment, it's a reset to your mind and your body. Dr. Lakshmi, thank you for this conversation. I am sure this is going to help a lot of people who are stuck in this constant scrolling loop. For everyone watching this video, try the 7-day reset plan and tell us in the comment how it worked for you. Also comment your questions you would like us to ask Dr. Lakshmi in the next video. And don't forget to subscribe to this channel so that you don't miss out on the upcoming videos. Thank you for watching.